What is free-floating anxiety? Have you ever found yourself feeling anxious or nervous without any clear reason why? This sensation can be quite confusing and unsettling. Let's break down what this experience is all about. Free-floating anxiety is a feeling of unease or nervousness that doesn't seem to be linked to any specific event or trigger. It can happen to anyone, at any time, and in any place. Imagine you're walking in a park or waiting in line, and suddenly you feel a wave of anxiety wash over you. You might feel butterflies in your stomach, muscle tension, or even a racing heart, all without knowing why. This type of anxiety can affect both your mind and body. On the mental side, you might experience trouble concentrating, racing or negative thoughts, and a general feeling of unease. Physically, you could feel muscle tension, an increased heart rate, sweaty palms, headaches, or stomach aches. One of the main reasons for free-floating anxiety is our brain's evolutionary design. Our brains are wired to think about the worst-case scenario to help us prepare for potential threats. This survival mechanism can sometimes go into overdrive, especially when we're not actively engaged in the present moment. For example, if you're brushing your teeth or waiting in line, your mind might start wandering and coming up with all sorts of worrisome scenarios. Past trauma can also play a significant role. When someone experiences a traumatic event, their brain can go into survival mode, making them more sensitive to potential dangers. This heightened state of alertness can persist even after the threat has passed, leading to free-floating anxiety. Genetics and environment are other factors that can contribute to this condition. Some people may inherit a tendency towards anxiety, and living in a stressful or dangerous environment can keep your nervous system on high alert. Free-floating anxiety is closely linked to generalized anxiety disorder, GAD, but it's not a specific diagnosis on its own. However, it can still significantly impact your daily life, causing difficulties in work, school, or interpersonal relationships. To manage free-floating anxiety, there are several techniques you can try. Paced breathing, where you breathe deeply into your belly and count your breaths, can help calm your nervous system. Listening to relaxing music or practicing progressive muscle relaxation can also reduce tension and anxiety. Seeking help from a mental health professional is often the best course of action. Therapies like cognitive behavioral therapy, CBT, and mindfulness-based stress reduction, MBSR, can help you identify and change negative thought patterns that fuel your anxiety. Remember, while free-floating anxiety can be challenging, it is manageable with the right strategies and support. By understanding what it is and how to cope with it, you can work towards a more peaceful and anxiety-free life.